Mark, thank you very much. And Chris, thanks. And I would certainly bring you greetings from the Springfield Area Chamber of Commerce. Certainly we are privileged to be a co-host this morning, and it's great to see so many chamber and community leaders with us this morning. And it's also great to see so many of our friends from Mizzou who've made the trip to Columbia on this busy Thanksgiving week. We appreciate you doing that very much. This morning we are celebrating, I think, a most significant collaboration and partnership. I think back, it's soon to be 4 years next month. And in fact, in January, when a letter of agreement was signed, and I quote, to explore the potential for University of Missouri School of Medicine clinical campus in Springfield. And the individuals signing that letter of agreement were Dr. Brady Deaton, Chancellor of the University of Missouri, Dr. Howell Williamson, Executive Vice Chancellor for Health Services at Mizzou, Dr. Robert Churchill, who was Dean of the School of Medicine, John Swope, President and CEO of St. John's, and Bob Zanson, President and CEO of CoxHealth. So now, almost 4 years later, a lot has happened, even to the signatories. Bob Churchill, Dean of the School of Medicine, and Bob Zanson, President and CEO of CoxHealth, have retired. Brady Deaton retired less than 2 weeks ago. St. John's is now Mercy. And John Swope is now a new regional president for Mercy. Howell Williamson is the last man standing. He's still there. So since the letter of agreement was signed, a lot has happened in the vision, soon to be a reality, of bringing additional medical education to our region in the form of the University of Missouri School of Medicine Springfield Clinical Campus. And to tell us more about this project, as well as provide an update and status report, we have 4 outstanding panelists with us today. And I will introduce them. I would ask them to come forward and take a seat, and we will begin the more formal part of the program. I mentioned his name a moment ago. We are privileged to have Dr. Howell Williamson, Executive Vice Chancellor of the University of Missouri Health System, with us. Hal, if you please come forward and take your seat. We have with us Steve Edwards, President and CEO of CoxHealth. Steve, please come forward. We have Dr. Robert Steele, President of Mercy Health here in Springfield. And we have Weldon Webb, Associate Dean of the MU School of Medicine. Gentlemen, please take your seat. And let's recognize all these folks with your applause. We have not rehearsed this, I promise you. But the format I would like to do is we'll ask each of the panelists to spend no more than 5 minutes to provide a perspective on the project from their point of view. That would be no more than 5 minutes for them to provide that perspective. We'll try to watch the clock in that regard. And then after each of the panelists have spoken, we will have a chance to entertain your questions, because I promise you there will be some questions and there'll be some inquiry that I think you would like to ask of the panelists. At your place this morning is a case for support. I would draw that to your attention. I think it does a great job overviewing the project, and frankly, some of those items we'll be talking about this morning. So let's begin, gentlemen, if that's all right. And first, let's start with Dr. Howell Williamson, Executive Vice Chancellor of the University of Missouri Health System. And Hal, you've been involved in this project from day one, so give us your take, because a lot has happened in the last 4 years.
Thank you, Jim. I'll do that, and I did hear the thing about 5 minutes, and you know how academics are, but I think I can do it in 5 minutes or less. I wanted to tell you that a little bit about the background of the project, and Weldon Webb on the other end of the table will, from the MU side, will talk a little bit more about the program and the future. Going way back, the University of Missouri has been in existence for 175 years, the School of Medicine for 160 some years, and like most public medical schools, MU has an obligation, a social obligation to provide physicians for our state. And I would say that MU has taken that more seriously than most state medical schools. You may or may not know, we're actually, I think, the smallest medical school in Missouri, and we have the plurality of practitioners in Missouri who are MU graduates. So I think we've taken that fairly seriously. I been working with leaders at these two health systems and others in Springfield on a variety of projects related to health professions education going back to the early 90s. Mr. Webb and I started a program at MU called the Rural Scholars Program, in which we placed students in smaller communities throughout Missouri, understanding a lot of educational literature which suggests that students tend to go back to the places they came from and the places they trained in. That's been a very successful project, and Mr. Webb and I learned a lot. We made some mistakes during that time, and the good news for you all is we won't have to make them again. During that time, the leaders in Springfield said, well, why don't you put students here? And we said, look, this is really for smaller communities. Thank you for your support. And Dave Barb and many other people have been very helpful for that program. But about 4 or 5 years ago, these three organizations all approached each other again and said, well, maybe the time is right. The AAMC, the American Association of Medical Colleges, put out a call about 7 years ago for for medical schools specifically to increase the production of physicians in the United States, expecting a physician shortage, and depending on who you believe, that's still predicted to happen, given there are many of us who will consume more health services in the future than we do right now. That seemed like a very good background for these three organizations to reapproach each other, and we've spent about the last 3 years really working on an important series of details, about what kind of infrastructure would be required in Springfield, what is the infrastructure and superstructure growth that would need to happen up at MU, because we need to go up there by 30% too, because this program really involves the 3rd and 4th, the clinical years of medical school, to be taken in Springfield. We recognized for a long time that the health systems in Springfield are large and of very high quality and serve a huge part of the population of the Midwest. So this is a logical place for us to come. The leadership of the organizations, and hats off to people like Weldon and David Barb and a lot of other people in the room who have really pushed the project and made it happen. And we are now at the point where we have secured state funding, which we thought could be the most difficult thing. We have secured a state funding for the operations, I should say. We have secured an infrastructure plan and a plan that would work very well for having students down here. A faculty development plan, a plan to help be sure that the students get the same experience or equivalent experience that they would get here in Columbia. Mr. Webb and our senior associate dean have traveled around the country looking at other systems and how they're doing that. So it's actually lined up really well. We're very excited about it. I'll let Weldon field the question about when the first students could be here. Right now, the remaining barrier is the acquisition of a lot of money, about $40 million for the capital costs that would need to be done both here and in Columbia. So that's where we are. We're really excited about having Springfield and these two great health systems as partners. It really fits nicely with our mission. Our leadership at the medical school and our faculty are very excited about it. And obviously, there are a lot of medical students who aren't getting into medical school these days who are very qualified, who are going to be excited about it too. So I'll be happy to come back later and answer questions. And I think, Rob, you're next, if I understand it right, Sarah?
Al, thanks very much. And again, Dr. Ron Steele, President of Mercy Health in our community. Ron.
Thank you. So let me take a little bit a similar path with history. And just from a personal standpoint, when I came to Springfield about 16 years ago, aside from all the folks that I met at Mercy, one of the very first folks that I met was Dr. Ted Groshon from MU. Has been part of this community coming down from Columbia for many years. So just simply from a practice standpoint, there's been a lot of collaboration from MU, both informally and formally with Mercy. But if we take just strictly a Mercy perspective, so what is it, what do we get out of it? What does Mercy get out of the MU relationship? Well, there are a lot of changes that are going on in healthcare currently, and while everyone points to all the changes with the Affordable Care Act, there are a whole lot of other market changes that are occurring as well. I do believe, I'm one of the believers, that we will have a physician shortage going up through 2020, and that comes from a lot of different things. Now, we've just recently opened up our orthopedic hospital. We just celebrated opening up the children's hospital. We'll be opening up a rehab hospital in April of 2014, all of which requires manpower. This past year, we recruited just over 80 physicians, and to date for this year, we've recruited over 40. That's a lot of doctors, and yet it's still not enough to be able to take care of the population that is increasing here in Southwest Missouri. And we realize that we've got to have a pipeline. Well, those physicians, when they come, what we recognize is that we're able to sign about 84% or so of the physicians that we offer a contract to once they come here, and once they figure out how great it is to live in Springfield and in Southwest Missouri. This area will sell itself, and that's great, but you got to get them here. Someone from small town or large town northeast in New York. You say Springfield, Missouri, I mean, those folks up there, they know there's like New York and there's California and then there's some stuff in between. So getting them here is part of the difficulty. Well, if we can home grow our physicians, then that helps us out. As much as I'd love to poach as many family practice physicians from Steve's program in residency, that's still not going to keep the pipeline going. So for us, manpower is an issue, but there's another part to that too. All the changes that are occurring, aside from the Affordable Care Act, just in the marketplace, and I'll give you an example. So CVS, Walgreens, and Walmart have declared that by 2020, they will be the largest provider of primary care services, which is kind of a crazy thought. Now, as that goes through, that means that as much as Steve and I are significant competitors, there's sort of this other, I wouldn't say 800-pound gorilla with regard to a competition. And while we're trying to drive an integrated care model, we recognize those things are happening in the marketplace. Well, aside from just the manpower that we're looking for, we'd like to have physicians that we can train in understanding what an integrated model means. How is it that you can deliver care? How do we change the care model in a way that we think will drive value? And to the degree that we can control that as part of collaboration between MU and Cox and Mercy, we think that that's helpful, and certainly helpful for Springfield, Missouri. So it's a manpower issue, it's a training issue, and I think that with this collaboration, we can do that.
Dr. Steele, thank you. Dr. Steele, again, President and CEO of Mercy, and Rob, the self-described poacher this morning. Steve Edwards, now President and CEO of CoxHealth. Steve.
Thank you, Jim. It was great driving up this morning and pulling in the parking lot and seeing so many MU bumper stickers and signs, and what a great season the football team's having. I know many people here were at the Big Road in Oxford this weekend. That's really neat. I'm not an MU alum, but I'll say that my football team from my school has not lost in over 80 years. And so any of the Drury alums out there can stand with me in our program. We have all the same challenges. There is a bolus of patients coming through our society that will need more health care, and that's baby boomers. We anticipate that once you get in the age group above 65, you'll use about 7 times more health care resources than those below 65. And to confound the problem, that means those same people are leaving the workforce. We need about 250 more physicians in the next 5 years in our system. We're bringing in 50 to 75 every year. We're having good success, but the demands will grow and grow and grow. And there's no better way to bring physicians to the community and have them kind of grow up here in training. Early on, we looked at what would it take to create a medical school. Springfield is one of the biggest population areas in the country without a medical school. And if one were to create a traditional medical school, the math is it would cost about $1 billion to start one. And then you'd start one from scratch, and it wouldn't have the history or reputation or credibility of an existing school. MU, and I'll let the MU people talk about it, but I've heard as of a month ago they had 1,700 applications for 96 spots. And that number's probably risen, I suspect, since it's enrolling. And we know that those first 96 spots, the next 200 or 300 are probably almost identical in terms of credentials And so there are people from Southwest Missouri, probably 22% of MU student base is from Southwest Missouri. And that means that they are having a hard time getting in, and they're going to other medical schools. And if they go to other medical schools, and they don't come back. And so this is really important for our medical community. I think the energy around education and research is really powerful for a community, for a medical community and for community overall in terms of business. So we're really excited about it. It's been a work in progress that's moving more quickly than we might imagine. A medical school from scratch would take decades, and we're going to have one starting up very soon.
Steve Edwards, President and CEO of CoxHealth. Steve, thanks very much. Our next speaker has been referred to by previous speakers. And if there's a spark plug for this project, it's welcome. If there's a godfather of the Springfield Clinical Campus, it's welcome. So ladies and gentlemen, let me introduce Walden Webb, Associate Dean, University of Missouri School of Medicine. Welcome.
Thanks, Jim. I think I prefer the Godfather one. This has been quite a journey over the last, and it's been over 5 years for a few of us. Is David Taylor in the house? Did David make this morning? Anyhow, David works for Cox, and Dave Barb. I want to talk to people named David in the beginning. So, but David Barb and Dave Taylor, I had a history of working on the rural track program in this part of the state, which we started in 2004, not in Springfield, but in Monette and Aurora and Mount Vernon and different communities around southwest Missouri. And we got to talking, the three of us, about this possibility of expanding class size and building a clinical campus. And I think it involved maybe a couple bottles of wine also one night. So anyhow, that was really the beginning of that whole project. And I give a lot of credit to Dave Barb and David Taylor for kicking this ball down the hill. So, and we're here now. So, but anyhow, just to give you a little bit the issue that Mr. Edwards was talking about, and recruiting of physicians, just to go back. When you look at physicians and where they wind up practicing, there's really 4 major determinants of where they wind up practicing. Is first of all, where did you grow up? Where'd you go to medical school? Where'd you do your residency? And we've kind of figured those 3 out. The last one we're still working on, who do you marry? So those are really the 4 determinants. So if you look at our class size at Mizzou of 96 students, after St. Louis, Southwest Missouri is our biggest feeder in the medical school. So there's number 1. We've got a lot of students coming from Southwest Missouri. They're going to a really great medical school in Mizzou. They're staying in state. We have a history of putting physicians back in the state working. And as Dr. Williamson mentioned with our rural track program, which we started back in '95, the students we pre-admit to that program, over 85% of them wind up staying in Missouri. And all the students who take part in that program, almost 60% wind up practicing in a small community in the state of Missouri. So we think we have some history on how to do that. But anyhow, how's this going to work? And I'm usually not the one who talks very much, but the clinical campus, we will increase class size by 32 students per class. And so that will start actually we'll admit that first class in 2016, July of 2016. We have to get some infrastructure. We're landlocked in Columbia. We can't add any more students in our situation, so we do have to build facilities, so we will do that. But starting in July of this coming year, 14, we'll admit 8 extra students because we had some capacity there through the Caring for Missouri Scholars that we did a few years ago. So we'll admit those, and we'll actually have students in our pilot phase here in Springfield in July of 15. Actually June of 15 they'll start. And then we'll admit that full class in July of 16, and then those students will show up in July of 18 in Springfield. And then totally, when fully implemented, we'll have 64 to 70 students here at all times, and then the M2, M3, and M4 year. So that's kind of an overview, and I can ask more questions about that later. And then the economic impact of this, we hired one of our economists, and I really didn't want to hire him, and Jim made me do it because he works at Mizzou, and I thought it might be a conflict of interest, but he's really the national expert on doing this. And when this campus is at full bore, the economic impact is around, for the state, is around $400 million a year, and about $325 million for Southwest Missouri. And and we'll train a lot of physicians who will stay in the state and stay in Southwest Missouri and go to work for Dr. Steele and Mr. Edwards. So tremendous impact, tremendous economic impact through the whole thing. And then the last, as Dr. Williamson mentioned, is funding. We're moving forward with our buildings without all the funding in place, but we think we'll be able to accomplish that. We're planning the space in Columbia, and as I was telling Steve and Rob, we need to start planning the space now here in Springfield, and I'll be spending a lot more time starting January the first year. So, but the funding that's $40 million, and we want it to be a combination of university funding, state funding, and private funding. So we're still putting that model together, but we're not waiting until it's together designed, because we've got to move and move quickly. So, and if you know about building buildings, it takes a while. But the university, which is not, it's a large bureaucracy and always not the quickest to respond, they're pushing me to get this building built. So that's very unusual. So thank you.
Well, go ahead, ladies and gentlemen. Let's thank all of our panelists for their... We now have time remaining for your questions and certainly your answers from the panelists. I would like to start, and Walter, you talked about the project timeline certainly, but can you drill down a little bit more? What are the things that really have to be done between now and well, certainly the 8 students next year, and then certainly the completion of this project? As you say, it's now moving at warp speed.
Right. I think the things that are in place is how, the students, and the way we're going to admit students to this program, there's different ways of doing it. We looked across the campus. Some places would admit those 32 students right into the program and say, you're going to Springfield. We decided it was best not to do that because we wanted, remember, this is one medical school in 2 locations. It's not 2 different medical schools, it's one medical school, and we want to keep that thought within that class. And so they will be admitted to the medical school, and sometime in, knowing that they may go to Springfield, or they may stay in Columbia. And so sometime during the M2 year, probably early on in the M2 year, there will be a sign up for those students who want to come to Springfield. And if we don't get enough to come to Springfield, then we'll do a lottery. But I can just tell you most clinical campuses, and that's the way they do it. And Wichita is the one that we've looked at a lot. In 40-some years, they only had to institute a lottery twice. Quite frankly, I think we'll be overprescribed for the students who want to come to Springfield because of the quality of the educational experience. And it'll be equivalent, but it will be different. And for many of those who've gone through medical school and with our rural track program, the student is usually the only other person in the room with the physician when they're in a clinical enterprise like here in Springfield. So we're excited about that. We have to identify some space to call home here in Springfield, and I've told Steve and Rob I wanted to be on National Avenue. I wanted to be between the 2 healthcare enterprises. And a lot of people ask me questions about, well, who's going to decide what we do where? And I said, not me. And that will be worked out by the physician leadership groups within the 2 clinical enterprises. And the biggest thing we've got to do right now is start identifying people who want to be part-time clerkship directors in a different specialty and people who want to teach in this medical school. We know some of those people already, but that is really the next thing that I need to work on. Facilities here, and also identifying physician leaders within the community.
We have looked at a lot of best practices, a lot of models, which certainly is a model we've looked at. Some of you know we do annual community leadership visits, and there are 2 in recent years that are models, 2 peer cities. One is Spokane, Washington, and the other is Grand Rapids, Michigan. And in both of those community leadership visits, we observed what those 2 communities had done to bring medical education, certainly clinical campus, and medical school to those communities. So we have looked at a lot of peer cities and what they've done, and certainly the way they have made that happen. I'm sure you have questions. I have more I could ask, but I'm sure you have questions. The panelists, we have mics. The room is probably small enough. If you can yell out, we can do that. So who wants to ask Gary? Whitaker, please.
Drury already has a pre-med program, plus there is another state university here. Is there collaboration, or is this a siloed program separate from the
Well, I would say that since siloed is a bad word, they surely aren't siloed programs. But I would say that this is a project of the MU School of Medicine. And right now, there is not planned to be collaboration between Drury and MSU. And that is not to say we plan for there not to be collaboration. It's just not clear where the collaboration would be. Mr. Webb has several ideas about once we get a footprint on the ground, once we have some students here, how that might go back and forth. So joint programs between the PA programs and the various health profession programs that are at several institutions, not just the two you mentioned, would be very logical. The pre-med program that we've had at Drury since 1995 or whatever it is that we've been working with on our Rural Scholars Program, those would be really logical things to fit in. So I didn't mean to say that they were siloed in the sense that we've decided not to have any collaboration. It's just getting the medical school clinical campus up and going is kind of its own project. And when that happens, we think there'll be a lot of opportunities. Mr. Webb is waving his finger, which means that he wants to talk. I think he's going to talk about his simulation program.
Two things that come to mind, and we've had a lot of experience in our rural programs in St. Joe and Rollins, Sykeston, and different places. And once we have the infrastructure and the clinical enterprise for education, what we've seen happen is other health profession schools join in with us, and we do an interdisciplinary stuff, especially in St. Joe. We have like 4 different medical schools now, and there are students there. There's nursing students, there's graduation students, there's health-related students. And so once you put the infrastructure in place, I think that will happen, and we certainly want to see that happen. And the other thing that we've been talking a little bit about in this community is, as you know, simulation is becoming a very large part of the health professions educational programs, not just for students, but also for practitioners. And it's also very expensive. And one of the things that I would like to see the community talk about is building a regional simulation center within this community that would serve not only the educational institutions, the 2 healthcare institutions, but also the fire departments and the police departments. And all those people have to be recertified. We now go out in a lot of rural communities with our local simulation band to help them do that even down in this part of the state. So again, simulation is very expensive, and it's something we could do together. And that would be a great place to start.
Next question, please. Yes, John.
Give us some idea of the square footage or the footprint that is required for the physical facility here, and also how many physicians or administrator types would be required here in Springfield.
We're running short of mics. We'll use this one. I think that's good.
The physical facility is pretty small, and I don't remember exactly. We'll have about 12 full-time employees here, and including a dean, which for the future will be me, a curriculum person, a student affairs person, and support staff. And so, and some learning space, place for faculty to meet with students. So, but we're probably talking 5,000 to 6,000 square feet, so that the physical presence will be, the students will mostly be in these 2 gentlemen's hospital. And what we will do is be doing renovations in some of the conference rooms or well-classified conference rooms and learning space for the students. We'll be putting infrastructure for communications back to Columbia through ITV in different areas. And probably the biggest commitment that the 2 health systems, well, the second biggest commitment the 2 health systems have made is providing call room space within the 2 hospitals, because that's something you have to provide for students. And I learned long ago, it's easier to get $1 million than it is 100 square foot in a hospital.
Thanks, Weldon. Next question, please. Surely there are more questions. Yes, please, sir.
I'm Dr. Jim Waterfield. I'm president of the Smith Link Holloway Medical Foundation.
Yes, sir.
And my question is to the hospital administrators, to what extent have the hospital administrators committed to the funding of the board meeting?
You first.
Yeah. 25 words or less, right?
So I would say, just going back 4 years ago when this began, we knew that there was going to be a funding amount that we were going to have to do. And from the very beginning, both Cox and Mercy have been committed to being part of the solution. Now, $40 million is a lot of money, and as Dr. Williamson has mentioned, there are some streams that have already been identified. Currently, after going through the economic impact within the community, we have felt that this is a community solution. We're part of the community, and so, and I won't speak for Steve here, but Steve and I have committed to being part of that solution from a monetary standpoint. There's still some money that is required to be raised, and we're part of that solution as well. How exactly we're going to get there and what that combination between Cox and Mercy and the rest of the community is, we have yet to figure out entirely. But we have publicly before and now have submitted that we will be part of that solution.
Steve, would you like to comment?
Well, Rob said it very well. This doesn't come together unless the community comes together. Cox will have financial support for this program. It means a lot to us. This is an investment, and I suspect Mercy will too. But if we are the only ones providing support, it will be successful if we want to. So you'll see that support. As chairman of the Smithman-Callaway Foundation, I would hope to see more support from other entities in the community as well. No comment.
Next question. Surely there's another question. Anybody else? Going. What I'd like to do is ask each of the panelists, they're not required to do this, but if they have any closing comments or perspective, I think it'd be appropriate to hear from them before we wrap up with a couple of other things this morning. So Dr. Williamson, let's start with you, please.
Great. So it's great to be back here in Springfield, and I say back here because, as I mentioned at the beginning, I've been working with medical educators in Springfield for, well, since the early 1990s when I was residency director. So very exciting, great community, lots of great doctors. I can't say that I'm as excited about this as Weldon is, because he's like opening Christmas presents for the last 2 years. So, but it is really exciting. It's a great partnership, and I think actually it's very likely that it's a foundational partnership for many other things that could happen between Columbia and Springfield, and between MU and the educational and businesses in Springfield as well. So very, very excited about the possibilities here.
Al, thank you. Steele.
I guess I would underline that Mercy is certainly very interested and excited to be part of this effort. Gathering from the number of folks in the room, which is fairly substantially increased from other breakfasts, I think there's a lot of interest within the community about this, and it's well placed because this effort will significantly improve the funneling, the education, really a lot of aspects of Springfield and Southwest Missouri. So I guess I would ask those of you in the audience that as we move forward, this is not, while we're kind of highlighting the MU, Cox, and Mercy triumvirate, we're only just sort of the figureheads or the talking heads up here at the table. It really requires a large constituency within the community to bring together the resources to make this occur. So, so I appreciate the legislators that are here, as well as the community and civic leaders here. It requires all of us to bring this forward.
Rob, thank you. Steve?
You know, this sort of thing doesn't come together without a common vision and most importantly without trust. And it takes a trust of this whole community to bring it together. I will tell you that how we probably first met nearly 20 years ago. As Dr. Williamson was head of the residency program at MU, we had a residency in Springfield at CoxHealth, and we began to cooperate. We now do more things with MU as well, with neural surgery rotations and orthopedic rotations. Few know that Cox and Mercy, although we are dogged competitors on many fronts, we also try to collaborate and cooperate when we can, those services that we can bring to our community more affordably. This is the best example I can dream of how we can come together and better our community.
Steve, thank you. Weldon?
I have one more example, Steve, but I'll get to that in a minute. I got lots of time. You know, just to talk about personal for a moment, I grew up in a little town of Newburgh, which is near Rolla, which was a division point on the Frisco Railroad. My dad was an engineer, and so I spent a lot of time in this community. Back on Allen Square, the man on the street, KWTO, and so I have a lot of fond memories of this community and listening to the radio and then the TV stations when they came along. So I'm very committed to this community, and if you think about this year, this past legislative session, And due to the efforts of our delegation in Columbia and the delegation here in Greene County, we were able to get an appropriation of $10 million. And I think your legislators will tell you that that's not an easy thing to do. And it's a recurring dollar. So I think you need to think about Columbia and Springfield finding things to work together, because they did on this and they were successful. And I think that those two communities can find things, especially around higher education, that they want to work on. I think there's no end of what they can accomplish. I think we've kind of had a history of not working together in the past. I think if we can work together on these issues, it's amazing what we can accomplish. And then the other thing is, we'll have a clinical campus here, but the next thing that needs to happen, and let me tell you, after working with these two health systems, we have not had one iota of issues of competition around a common goal, and that's education. I think the next thing that needs to happen is the growth of graduate medical education or residency programs in this community. And again, I think that's something they need to do together, because it's expensive, it's hard, but to finish that pipeline, it's critical, because again, if we have students from Southwest, they go to Mizzou, they do the residency program, high probability, probably 78%, they will stay in this part of the state. So that is the real key to finishing the pipeline. And again, you talk about recruiting physicians. Many times you recruit physicians from somewhere else and they come to a community and they don't stay. If you have somebody who's been from this area, who's been through medical school here, has been through residency here, they're going to stay. So I think it's really, really important. I'm excited to get started. And the last thing, I've had so many people helping this community, and I mentioned some of them, but the other two people who have made my life unbelievable is Vicki Nelson and Mary Johnson from Mercy and Vicki from Cox. They make my life easy here in Springfield, and getting on these two guys' calendars and just getting things done. So I really, really appreciate that. Thank you.
I think we need to thank all of our we do celebrate, I think, a most significant collaboration and partnership, and you've heard more about that certainly this morning. It's great to see so many chamber and community leaders in the audience, as well as all of our friends from Mizzou who made that trip to Columbia on this very busy week, needless to say. I again, on your behalf, thank Mark Thomas and Chris Kelly and the entire corporate relations staff for putting all this together today. Tremendous crowd this morning, which I think is an indication of the support of this community, this region, for this project. This is a tremendous economic development project, not just for our region, but for our state. It truly is a game changer. And we're going to look back and say this was a turning point in so many ways for this community to even go to that next level. Before we completely close out, I would just simply say it's my wish and prayer that you and your families have a most bountiful and blessed Thanksgiving. It's the most special holiday, and please enjoy that with your family and your friends. And to close us out, let me again reintroduce, bring forward Ori Colbert, who's going to do a special presentation. Ori?
How about a round of applause for Jim?